Warning: this video was created for educational purpose. The main goal is to provide scientific and public health related information in an understandable, easily digestible manner, with a portion of humor. Might contain disturbing disease-related images and information. Hello and welcome to another video. Today we will talk about teratogenesis. Teratogenesis is defined as production of developmental malformations, also widely known as mutations or anomalies. Congenital anomalies can occur during the developmental stages of the embryo from abnormal genetics passed on from the parents who have been, for example, living in radioactive environment, or from vivid environmental factors. Teratogenic factors pose a greater risk to the fetus, as these abnormalities may go undetected until birth. These malformations are the origin of the infant's postnatal illness and disability. Environmental exposure to teratogens can create long-lasting effects, but can also eventually lead to fetal death. While multifactorial congenital disorders stem from various sources, including obvious genetic factors, teratogenesis is solely triggered through conditions outside the womb, such as drugs, chemicals, or infections. For the first time, teratology was discovered in the 1930s, after various experiments were performed on pregnant pigs. In these experiments, pigs were fed with a vitamin A deficiency diet. Eventually, all those piglets experienced devastating malformations and the principal loss of eyes. It is the lack of public health care for pregnant women which is the main contributor to contact with teratogenic factors. And it is socially disadvantaged women in poorer countries which have to cope with most devastating outcomes. And now let's have a closer look at selected teratogenic factors and their risks. Alcohol. During the primary 4 weeks of pregnancy, the baby develops the 4 most crucial organs and organ systems in their body, such as the heart, central nervous system, eyes, arms and legs. The baby's brain starts developing around the 3rd week of its intrauterine life and steadily matures together with the pregnancy. Alcohol ingested by the mother can easily bypass through the placenta. Its breakdown within the baby's body is way slower than in the fully mature adult body, thus causing irreparable changes in fetal development, such as fetal alcohol spectrum disorder, also known as fetal alcohol syndrome. Interestingly, several celebrities have stated to be living with fetal alcohol syndrome. According to Top News, those are, among others, Bernie Sanders, Reese Witherspoon, Jim Carrey, Daniel Radcliffe. A brief summary of FAS facial features as follows is small head, small eye opening, low nasal bridge, flat midface, smooth philtrum, thin upper lip. Retinoic acid, also interchangeably used with vitamin A. The surplus amount of fat-soluble vitamins, which is the vitamin A, of pregnant women often end up in fetal malformations. The involved organs are the fetal skull, face, limbs, eyes, and central nervous system. Anomalies during prenatal and postnatal life of the infants include cleft palate, anosia, which is the complete absence of the ears, or microtia, which is the abnormal smallness of the ears, heart defects, and thymus abnormalities. Therefore, it is recommended to avoid surplus of vitamin A, such as eating liver products, but also avoid taking unnecessary vitamin A supplements. Antibiotics. Many antibiotics are recognized to be teratogenic and must be avoided completely during pregnancy. Those are streptomycin, kanamycin, and tetracycline. These drugs can cause hearing impairment, delayed development of organs and bones, as well as teeth. Therefore, it's recommended to avoid entirely antibiotics during the first trimester of pregnancy, because the major fetal structural transformations occur during this term. Furthermore, it's recommended to limit the use of over-the-counter drugs. Anti-cancer drugs. For several years, the number of women diagnosed with cancer has increased in huge numbers during pregnancy. The most frequent cancers reported in pregnancy are breast cancer, cervical cancer, malignant melanoma, which is the cancer of the skin, and malignant lymphoma, which is the cancer of the lymphatic system. Congenital malformations are more likely to occur if the cytotoxic anti-cancer drugs are prescribed during the first trimester of pregnancy, because the fetus at this stage encounters rapid cell division and organogenesis, which is the development of organs. Anti-neoplastic treatment, which stands for treatment preventing the development of new cells and tissues, provided to a pregnant lady at this time, may involve fetal risks such as stunting growth, systemic toxicity, abortion, and death. Therefore, the use of anti-cancer drugs should be avoided unless the mother's life and health are compromised. Even though chemotherapy is administered during the second trimester onwards, there is no escape from the effects of fetal malformation. Furthermore, it is recommended that pregnant women who are freshly recovered from any chemotherapeutic treatment do not breastfeed their infants. Infectious agents. Such infectious agents as rubella, mumps, influenza virus, varicella, and syphilis pose a significant teratogenic threat. While the former two can be effectively prevented by taking the MMR shot, mumps, measles, and rubella vaccine, main danger of syphilis is that it will give a pathway for HIV transmission to the mother. This can result in serious illness to the fetus, causing stillbirth, fetal loss, prematurity, low birth weight, neonatal and infant death, and many congenital diseases in newborns. But let's go one step back to the influenza virus. Influenza is a complicated virus, causing major illness involving more than just a runny nose and sore throat, and the flu has a catastrophic effect when you are pregnant. Flu is transmitted by respiratory droplets from one person to another. The severe complication from flu to a pregnant woman is infectious respiratory diseases such as inflammation of the lungs. The fever from the influenza virus can give rise to numerous defects in infants. Many mothers who are in their first trimester and experiencing cold or flu along with fever are more likely to have a baby delivered with congenital disabilities. They are, among others, neural tube defects, spina bifida, anencephaly, cleft lip with or without cleft palate, and limb reduction. When pregnant women did not suffer from fever, they are far less likely to encounter any defects in their newborn babies even though they had the flu. Being precautious and actively immunizing yourself through diet or taking flu shots can help the baby to be born without any defects. Teratogenicity can also stem from maternal conditions such as diabetes. Diabetes is nothing but a condition in which our body cannot satisfy enough insulin, or when the body is totally immune to insulin in general. Insulin is a hormone in the human body. It helps to get enough glucose into the body cells to be used as fuel whenever there is no external food source. In pregnant women, not only does their body make hormones, but so does the placenta. The placenta is an organ that provides the baby with all the nutrients and oxygen needed to grow. The placenta makes hormones called estrogen, lactogen, and cortisol. All the hormones mentioned can block the insulin. This type of blockage is known as insulin resistance. It is insulin resistance that results in excess amounts of insulin in the mother's body and can create surplus sugar levels in the blood, giving rise to gestational diabetes. Complications for the infant of a diabetic mother are stillbirth, birth anomalies, mainly in the first trimester of pregnancy, birth injury, hypoglycemia, which is the lack of glucose, respiratory distress. Therefore, it is important to help glucose levels being in the normal range through incorporating healthy habits and foods to prevent the onset of gestational diabetes. Furthermore, it's recommended to eat foods higher in fiber content, low in fat and calories. Devouring fruits, vegetables, and whole grains, along with watching the portion sizes, is recommended. exercising daily for 30 minutes of a moderate workout can help you plan for your pregnancy at a healthy weight, not exceeding the recommended weight during pregnancy. Another important maternal condition is epilepsy. Pregnant women with this neurological disorder have a higher risk of fetal malformations in their developing babies, mainly due to the medications used to treat epilepsy. Examples are valproate, which can cause neural tube defects in the fetus, carbamazepine, which can cause intrauterine growth restriction, and microcephaly, which is the decreased size of the brain, and phenobarbital, which can cause a general developmental delay of the fetus. Radiation. Radiation is usually considered as low risk in comparison with other risks in pregnancy. Almost for all the diagnostic radiation treatments, pregnant women are exposed to less than 50 millisieverts. Such a low dose of radiation does not bring about any fetal health complications during pregnancy. The feedback after exposure to X-rays depends on the amount of dose given, dose rate, and radiation quality, the fetal stage at the time of radiation exposure. According to the embryonic and fetal development stages, risk factors are significant during the early fetal stages and organogenesis. Growth retardation can occur if the pregnant woman is irradiated after 4 weeks of gestation with a possible threshold greater than 100 millisieverts. After 8 weeks of gestation, the fetal anomalies risk factor decreases, whereas nervous system abnormalities, growth retardation, and childhood cancer can be more remarkable. Many of the abnormalities at the threshold of 100 millisieverts can be central nervous system related. To know more, check out my other video on this topic. Chemicals. Polychlorinated biphenyls, PCBs, are used as lubricants and coolants in most of the electric equipments. Polybrominated biphenyls, PBBs, are added to manufacture much plastic equipment like textiles, television, computers, and plastic foams. The PCBs and PBBs are the chemicals that can harm the fetus and the mother during pregnancy. The PBB shows its effects on fetal development, likely to induce reduced fetal birth weight and a shortened gestational period. And I can tell you there is much more to this. Check out my other video on this topic, in which a disastrous example of post-Vietnam War children is presented. To sum up, with frequent and proper medical guidance, pregnant women would not only gain awareness and understanding about teratogens, but they would be much more likely to prevent exposure during pregnancy. The developing fetus is fragile, especially in early embryogenesis, when the body starts to build tissues and organs. Mindfulness and avoidance must start early, if not before conception. Furthermore, it is crucial that environmental agents, drugs, and chemicals used in the workplace or nature are to be tested to certify that they are non-teratogenic or should be averted to give to the pregnant women.